Today we will going to see COPD. Okay, I will share the screen. I am sharing the screen. Just see, is it visible? Is it visible? Okay. So today we will see the COPD, that is chronic obstructive pulmonary disease. What? Chronic obstructive pulmonary disease. It is also called as a COAD. Means what? Instead of pulmonary, we can say it is airway disease. That is chronic obstructive airway disease. That is COAD. In exam, they will ask you either COPD or COAD. That is chronic obstructive pulmonary or airway disease. Now, what is this one? This is a respiratory disease. This is a come under respiratory disease. It is a persistent obstruction of the airways. Persistent obstruction of the airways. Airways, that is the respiratory tract. That is the respiratory tract, which is either partially reversible or completely irreversible. Means it is partially either reversible or completely irreversible. We will see in detail. It is usually caused by chronic bronchitis or emphysema. The two main causes, that is the bronchitis and either bronchitis or emphysema. In detail, we will see bronchitis means what and emphysema means what. Okay. Chronic bronchitis. This means inflammation. Which inflammation here? Inflammation of the bronchi. Inflammation of the bronchi. Chronic bronchitis is characterized by cough with or without expectoration, with or without sputum or expectoration, bulgum. Okay. For at least 4 months of a year for 2 consecutive years. Listen carefully. Bronchitis, chronic here we mentioned chronic bronchitis. Chronic means what? Long. Okay. Chronic bronchitis means inflammation of the bronchi. Why it is chronic here mentioned? Means what? Characterized by cough with or without expectoration for at least how many months? 4 months. For at least 4 months of a year for 2 consecutive years. Means 2 years consequently. It is 4 months. Means this year 4 months and the next year continuous 4 months. Okay. This is called chronic bronchitis. Now emphysema. Emphysema means what? It is the enlargement of the alveoli. Enlargement of the alveoli with destruction of alveolar spectra. With destruction of alveolar spectra. Alveoli, that is the end of the respiratory tract, where that is the grape-like structures are there. Emphysema, where the actual exchange of the gases takes place. Where the actual exchange of the gases takes place, that is called as a alveoli. Okay, we seen in the last, that is the respiratory tract in the human anatomy and physiology. Okay, this is the anatomy. Okay, emphysema means what? Enlargement of the alveoli. The size will get increased with destruction of the alveolar septa. With destruction of the alveolar septum. Chronic bronchitis and emphysema frequently coexist as persistent chronic bronchitis often gets complicated by emphysema. Chronic bronchitis, both bronchitis, not only the bronchitis, that is the chronic bronchitis and emphysema, both frequently coexist, means having coexistence in between. Okay, they are related to one another. The having chronic bronchitis also, and also with additionally, that is the emphysema, as a persistent chronic bronchitis often gets complicated by the emphysema, and again it is complicated by emphysema, that is the destruction of the, with enlargement of the alveoli and destruction of the alveolar septum. Inflammation of small airways, spasm of the smooth muscles, swelling of the linings of the airways may further worsen the condition. Means again, additionally, what happens here? Inflammation of the small airways, spasm of the smooth muscles, swellings of the linings of the airways. These also when it happens, that causes, that worsens the condition, that adds the condition, that again disturbs the condition, may exaggerate the condition, that is may worsen the further condition. Hyperinflation from exercise is linked to shortness of the breath in COPD. If we will exercise too much, then it causes the hyperinflation, that will again cause shortness of the breath in COPD, chronic obstructive pulmonary diseases. Now we will see one by one the etiology. Actually, main etiology cause, it is bronchitis and emphysema. But why the bronchitis and emphysema takes place? What are the reasons? What are the causes? What are the etiology behind this? We will see in detail. That is smoking, due to smoking, due to air pollution, due to infection, due to genetic makeup, due to occupational exposure, due to industrial dust, due to agriculture, okay, silica dust. So many are there. We will see one by one. Smoking. It is the common factor that impairs the mucociliary defense mechanism, that hampers the mucociliary defense mechanism and leads to overactivity of the mucus producing glands. Means actually these glands produces normally the mucus, but due to smoking it produces more and more mucus, that it obstructs the airway, that is the main cause due to the smoking, that exaggerate the condition. Okay, now we will see the air pollution. So many air pollution is there. We will see continuous exposure to various pollutants like industrial effluents. If we are living in the industrial areas, then industrial effluents, vehicle smoke, occupational exposure to organic and inorganic dust may result in COPD. So many air pollutants, and we can add here the pollen grains, home dust. Some of the people, they are having allergy to these small things also. Okay, so air pollution, it commonly, that is the industrial effluents, vehicle smoke, occupational exposure. We will see again downside, that is the what are the occupational where we are working, that the pollution, that having the pollution. Okay, industrial effluents. So occupational exposure to organic or inorganic dust. If we are working in the silica, if we are working in the cotton industry, then that cotton fibers, that will, if we unknowingly we will inhale, so that causes the obstruction in the airway. Continuous we are working there, that's why that causes the pollution. And this is means that area, that environment contains that type of the pollution in the air. And so these are the causes of the COPD. Now infection, next, that is the infection. Repeated infection of the respiratory tract. Due to what? So many things. Nowadays, what is there? Corona, that is the, this is also the respiratory tract infection, respiratory tract disease, isn't it? Due to what? Due to virus. That is, so many things are there behind that. Viral infection, common cold, microbial infection, so many things are there. Okay, so infection due to the viral infection, that is the commonly, that is the common cold, especially in infancy, may lead to COPD. In infancy, if it will happen, then it may lead to further, that is the COPD. Genetic makeup. Genetic makeup is some of the genes. Now here, inborn deficiency of the body protein called as a alpha-1 antitrypsin. Alpha-1 deficiency. Here, which type of the deficiency is there? Inborn. Means inborn deficiency is there. Which type of the protein? That is the alpha-1 antitrypsin. Results in EDC, damage of the alveoli to develop the emphysema. Due to that deficiency of these protein causes what happen here? Damage of the alveoli to develop the emphysema. Due to that damaging, it causes the emphysema, that is the enlargement of the alveoli. So genetic makeup means by birth only this takes place. Due to what? Which type of the deficiency? Alpha-1 antitrypsin protein. Okay. Now here again we are coming, that is the occupational exposure. Intense and prolonged exposure to workplace. How many hours we are working? At least 8 hours, isn't it? So we are there only working continuously 8 hours, and air, it is polluted. Which type of? Some cotton industries are there, some coal agent, coal industry is there, coal mills are there, isn't it? So intense and prolonged exposure to workplace, dust, chemicals, some are working on in the chemical industry, isn't it? And fumes, that fumes, sugar factory, isn't it? If we are living nearby to that industry, that fumes, if we will inhale continuously, that is the increase in the risk of the COPD for both smokers and non-smokers. Means what? Which are actually here I want to tell you this one. The fumes increase the risk of the COPD. Okay, the fumes, if we will inhale, those who are smoking, they are enjoying, but others who are not smokers but continuously they are inhaling that fumes, both will expose to COPD. So occupational exposure, intense and prolonged exposure to workplace, dust, chemicals, and here I mentioned here the fumes of smokers, both smokers and non-smokers also. Okay, those who are working in the VD industries, that is what we call cigarette industries or Bidi Karkhana is also there, isn't it? Bidi Kamgar, isn't it? They are most of the ladies, they are working there, isn't it? Tobacco, they are putting there in some of the tobacco, that some of the leaf, and they are preparing that bedi. Okay, so they are not smokers, but continuously they are working there. So this is the main reason, that is the occupational exposure. Okay, industrial dust, so many industries are there. A number of industries having high levels of the dust are there, isn't it? They include the coal mining, isn't it? कोळशाच्या खाणी, okay, coal mining, gold mining, cotton textile, occupations involving cadmium, isocyanides, and fumes from welding. Those who are working in the welding, that fumes, if they will inhale, that causes the obstructions to the airway. Okay, so many industries are there. Coal mining, they are inhaling coal. Gold mining, they are inhaling gold. Cotton textile, they are inhaling the cotton fibers. Okay, so agriculture also adds the additional risk. Agriculture, in this, the farmers, they are also inhaling some of this, the pollutions, while spraying the sprays, they inhale. Okay, so silica dust exposure, this will also come under the silica, that is the industrial dust. Okay, so these are the what etiology of this COPD, which we see: smoking, air pollution, infection. Side headings you keep in your mind, so that in that you will write the things. Okay, the side headings you keep in your mind. In your own language, you can write down in that. Okay, smoking, air pollution, infection, genetic makeup, occupational exposure, industrial dust. In that only you add this silica dust. Okay, agriculture, these are all the etiology causes of the COPD. Okay, now we will see the pathogenesis. Genesis means what? Production or synthesis. What they are? The pathogenesis, how the disease develops. Now we will see. Here I mentioned a schematic representation that is very simple way. Precipitating factors or the causative agents. Upper one we seen all the etiology. So one of this one, okay, or maybe two or three. These causative agents, that is the we called commonly, that is the precipitating factors. That causes what? Accumulation in the alveoli, that are deposited in the alveoli. What happens then? What happens then? Our defense system in the body, collection of the WBCs in the inflamed area. Due to this causes the inflammation, isn't it? Enlargement of the alveoli. Due to what? Due to these causative agents, there is an inflammation. There is an inflammation of the alveoli, and our defense, who is our defensive nature in our body? WBCs. What happened then? To eradicate that infection or inflammation, who will come? WBCs. So gathering or collection of the WBCs in that area, inflamed area. So what happens here? Releases the enzyme, especially neutrophil elastase. Which type of enzymes they will release? Actually neutrophil elastase. And damage of the connective tissue in the walls of the alveoli, and that causes the connective tissue in the walls, that where it is present in the walls of the alveoli, and that will damages, and that causes the COPD. Actually there they are come for the defensive. But what happened due to that enzyme? Due to that enzyme, if more infection, more inflammation is there, then it causes damage to the alveoli, walls of the alveoli, septa or walls of the alveoli, and that leads to COPD. If these infection causes persistently, concurrently, consequently, routinely, where we see in there that one chronic bronchitis, consequently 4 months, and this year 4 months continuously, and the next consequently next years, immediately after the next year, again continuously 4 months at least, then due to that it causes the COPD. Okay, now we will see. Understand this one, pathogenesis, what happens, precipitates the factors, that is the positive agent. So what happens here, the accumulation in the accumulate or deposited in the alveoli, and due to that, to defensive mechanism, who will come, WBCs in that area only, and that releases the enzymes, and that damages the walls of the alveoli, and that causes the COPD. Understood? Now we will see the symptoms. We will see the symptoms. Which symptoms are there? Repeated attacks of the productive cuffs with sputum, with belgum. Okay, productive cough we see, that is the yellow or greenish type. Okay, that we call it as a productive cough. Or sometimes what we, two types of coughs are there, productive or dry cough, isn't it? Only the dry cough is there. But here, repeated attacks of the productive coughs, especially in winter season. Especially in which season? Winter season. Wheezing, breathlessness, tightness in the chest, usually in the morning. Wheezing, the sound will produce wheezing sound, breathlessness. Okay, shortness of the breathing, we call it as a breathlessness. Okay, tightness in the chest, usually at what time? In the morning, because in the winter season morning, that is very cold, isn't it? So we feel like that. Okay, progressive increase in the respiratory disability with yellow or green sputum. Productive cough means only the yellow or green sputum, that we call it as a productive cough. Progressively it increases. Okay, so that's why there is a disturbance in the airway. We can't inhale due to that mucus, due to that sputum in which are present in the respiratory tract, which we cannot inhale. That is the passage way the air will not enter, isn't it? Smoothly, there is a disturbance. Okay, shortness of the breath during normal activity like washing, dressing, toileting, we feel like that the shortness of the breath is there. We can't breathe properly. There is a shortness is there. There is an obstruction is there. Okay, due to all these yellow, green sputum or productive cough, we can say. Severe weight loss and generalized edema. If continuously it is there, we can't take proper food, isn't it? So due to that, severe weight loss or generalized edema, swelling is there over all the body. Okay, slight fever and chills. Sometimes fever is there, chills, shivering is there, isn't it? Fatigue, due to all these activity, maybe there is most chances fatigue is there. Hypoxia and cyanosis. No oxygen, cyanosis is there. Hypo, that is less oxygen, less oxygen, due to that cyanosis is there, bluishness is there. Okay, chest discomfort, due to all these, the chest will causes what? There is a disturbances or discomfortness in the chest. can't sleep properly. If we are not able to take the what air, respire, then causes what? We can't sleep properly due to frequently obstruction in the airway. These are the common symptoms of these, which are those repeated attacks of the productive cuffs, maybe yellow or green sputum. Wheezing sound is there because we can't breathe properly. There is a shortness, there is a bronchoconstriction is there, isn't it? So while expiration, there is a sound is there. We see in the asthma. Actually, we will see what is there in the asthma bronchi, like a whistling sound, like a whistling sound. This is the wheezing. That is the sound is there. Okay, sound is there while respiration, while especially in the expiration, exhaling of the air, wheezing, breathlessness, and tightness in the chest. Shortness of the breath is there. Normal activities, that is the washing, dressing, toileting. Okay, severe weight loss and generalized edema, severe, slightly fever and chills, fatigue, hypoxia, cyanosis, chest discomfort, and we can't sleep properly. These are the simple things or symptoms that we can observe ourselves in the common cold or common cough is there. Then don't by heart, don't murmur these things like this. Okay, so you can write your own language, just you feel the disease so that we can understand and we can write automatically. Okay, automatically. Okay, now diagnosis, which are those diagnosis here? Physical examination, common diagnoses are there. Common diagnoses are there. Which are those? Normally physical examination, X-ray, chest X-ray, pulmonary function test, exercise test, blood examination, chest CT scan, okay, arterial blood gas measurement, okay. These are the common symptoms, which are those physical examination. While after going to the doctor, what they will check? Physical examination by checking by putting the stethoscope. Okay, they will check the breath sound. Okay, it is usually normal and initial stage, while in later stage the breath sound becomes hard. That is the wheezing sound we call it. Okay, X-ray. We will take out the X-rays. Which X-ray? Chest X-ray. That is the lung, heart, lung, large artery. It will come automatically, but we will see the actually the chest X-ray. Okay. Pulmonary function test, recording the force expiratory volume in the air in 1 second, and its ratio in the vital capacity, volume of the lungs, etc., reveal the pathological extent of the disease. We've seen this one. What do you mean by the vital capacity in the HAP? Okay, so in the respiratory system, so we have to check all these one, volume of this one, and we have to check the ratio of that one so that we can understand actually the lungs. Pulmonary means it is the lungs function test. Okay, exercise test, standard exercise tests are carried out to check day-to-day disability. Standard exercise test is there, that is we called as a exercise test. Day-to-day disability. Blood examination, which type of blood examination will be? CBC, actually complete blood cell count we will see, complete blood checkup we will see. In that all the cells we will see, and others are also we will going to see. CBC, that we call as a CBC. Blood level, here we will see also the By birth, if it is deficiency is there, which deficiency? That is the alpha-1 antitrypsin. Then here we will understand that by birth it is emphysema. This causes the what? Emphysema, inflammation of the alveoli. Okay. Then also the next step that we call as a CT scan. Which CT scan here we will take out? If it is not, we can diagnose, then go further for this CT scan. Which CT scan? Chest CT scan. And next one, arterial blood gas measurement. Arterial blood gas measurement. So all these points, diagnosis points, we remember. All these are understood. This one, physical examination, chest X-ray examination, and what? Pulmonary function test, exercise test, blood examination, chest CT scan, and arterial blood gas measurement. Okay. And next one, management and prevention. How to manage? We know the etiology, isn't it? According to etiology, we can stop and we can prevent, we can manage. If it is due to smoking, then avoid the smoking, stop the smoking. Just keep the house clean and tidy. Our area, our working area, everything should be clean and tidy. Okay, so we can avoid the air pollution, avoid the extreme exposure to the cold condition. We can't inhale, isn't it? All the respiratory tract will become dry. Are you experience this one? If we will go to the too much cold area, then we can't inhale, isn't it? So avoid that extreme exposure to the cold condition, and extreme hot area also we have to avoid that. But extreme cold, that is the more, this causes the more infection to the respiratory, isn't it? So avoid that extreme cold condition, avoid the allergens. If we have the allergy of some type of this one, if some of the having feathers allergy, some are having little dust allergy, isn't it? Pollen grains allergy. So avoid that one. If we understood, if we know we are having trouble to design this type of the allergens, so avoid that one. Avoid the high altitudes. More high, if we will go, there is a less oxygen, so avoid that one. Avoid the exposure to the precipitating factors, that is the etiological factors. Okay. Intake of selective food material. If some of the persons, individuals are having the selective food material, if they are eating that food material, that these food materials are allergic to them. So if we know we are having this and this type of the food allergy, avoid that one. Drink the plenty of foods. Okay, which type of the fluids? Warm or hot, not cold, freezed one. Okay, Coca-Cola, Pepsi, isn't it? Not that one. So avoid that one, but drink plenty of the fluids, which that one, warm and hot, to reduce the buildup of a thick mucus in the area, in that respiratory area, in the respiratory passage. Okay, if you will have warm or hot, it will melt, isn't it? It will not produce thick one. Okay, medications before heavy exertion and exercise. We are having the habituation. If we are taking after that one exercise or before, okay, don't take that medications before heavy exertion or before heavy exercise. Okay, some are having habitual of that one. Prevent the lungs from the infection. Be careful. Okay, we should not have these type of, we should not take, we should avoid the pollutions, we should avoid the allergies that causes the infection of lungs. Okay, if we understand, if we will have the cold water, freeze water, then definitely our respiratory system will hamper. So avoid that one. Receive the vaccination before possible exposure. Nowadays we are taking the vaccination of corona. So what, we are safe because these vaccinations is only what? The antigens. Due to that antigen, our body will produce antibody and we will be safe. So receive that vaccination. Use the air condition with a filter and humidity control. Okay. If you are using the air condition, then use with filter and humidity control. This is all about the management and prevention. Okay. So over there, this is very simple. If you know the etiology, then we can write the management and prevention. Because if we know the causes, how to avoid, we will write down. Okay. This is the very simple one. Now drug therapy. Inflammation, muscle spasm, and increased secretions are common manifestation symptoms, isn't it? And hence the therapy is related to that one. If there is infection, inflammation, what we will give antibiotics. This will control the microbial infection, isn't it? Antibiotics means what? These are which kills the which kills the microorganism. Which type of the antibiotics? Common, you can write down amoxicillin, ampicillin, cotrimoxazole. We can commonly use. Next, from the next or next year, you will see the drugs. Okay, in the ecology. So one or two example, it is more than sufficient here. Bronchodilators. Here in the bronchoconstrictions is there due to this infection. So use bronchodilators. What happens? The mucus will be go downside. It will not obstruct if we will take the bronchodilators. Okay. Which are those one? Nebulized salbutamol, terbutaline. 2 or 3, 1 or 2, it is more than sufficient. Okay, to relieve the spasm, Respirator stimulants. These are the intravenous infusion of certain respiratory stimulants, that is the doxapam with respiratory acidosis. 1 or 2 examples sufficient. Corticosteroids, if the condition is more, we can take steroids. Administration of steroids in some patient is recommended to relieve the inflammation, to relieve the check here, to relieve the inflammation. Okay. Oxygen therapy, hypoxia is there, isn't it? So we can give additional oxygen therapy. Nowadays, you are seeing in the corona, oxygen therapy we are giving, isn't it? Continuous oxygen therapy with the simultaneous arterial blood gas measurement is beneficial in severe cases to improve the blood oxygen level, mental status, and cardiac function. This is more important in the oxygen therapy. Okay. And physiotherapy, controlled exercise. Don't do more or don't do little. Okay, it is a controlled exercise. If we do more and more, then oxygen demand is increased. And if for that demanding, we should give more and more oxygen. If we will not get, we will collapse, isn't it? So controlled exercise under the guidance of physiotherapist ensures the quality of the life and reduction in the hospital stay. So, are we like to stay in the hospital? No, no. So, if we will do a controlled exercise, normal exercise, that is better. Or otherwise, if you are not understanding, then take the guidance. Okay. Replacement therapy, last therapy, that is the replacement of the deficient protein. Having deficiency of this type of the protein by birth, that is the congenital, that is the genetic makeup. So use that one. Okay, you fulfill that one, replace that one. Okay, you. So that's why there is not any type of the emphysema type of condition. Okay, last, that is the lung transplant. If totally damaged, then no chances are there, then directly lung transplantation is there. Okay, these are the therapy: antibiotics, bronchodilators, respiratory stimulants, steroids are there, oxygen therapy is there, physiotherapy is there, replacement therapy, and lung transplantation. Common complications, sometimes what happen? The complications may produce which complication? Another disease will produce, that is the pulmonary hypertension, right ventricular hypertension, isn't it? No oxygen, no anything, then maybe there is chances of the hypertension, okay, BP due to pulmonary vein, okay, pulmonary therapy. Right ventricular hypertension, leakage of the air into the pleural space, arrhythmias is there, secondary polycythemia is there, isn't it? Respiratory failure is there. Okay, these are the common complications. You will see one by one. Respiratory infection. Other are also there. Complications, respiratory infection. People with COPD more likely to catch cold, flu, pneumonia, isn't it? Already all the air passage is damaged, so they will prone to the simple colds, flu, pneumonia, isn't it? Any respiratory infection can make the breathing more difficult and can cause further damage to the lung tissue. Heart problems are there. Which type of the heart problem? COPD that increases the heart problem. Okay, so quit the smoking can reduce, that will reduces the problems. Lung cancer. More and more it is there, chronic condition is there, maybe there is a chances of developing the lung cancer. High blood pressure arteries, COPD can cause high BP, isn't it? And arteries bringing the blood to the lungs, leading to the pulmonary hypertension. The vein is there, isn't it? So due to that, it increases the BP. Depression. Difficulty in breathing can cause reduced activities leading to depression. If we are not inhaling properly, then our brain will not working, isn't it? So maybe there are chances of depression. Always we are saying that the environment should be good, isn't it? Free, airy, aeration is there, means ventilation should be there, because oxygen is needed for cells and cells. Otherwise, what happens? There may be chances of depression. Okay, this week covers our today's COPD. Okay, I will stop here only.